Hi, my name is Sabrina Baird-Gerber, and my video is about Project Hope. HOPE stands for Health Opportunities for People Everywhere. Its mission to achieve sustainable advances in healthcare around the world by implementing health education programs and providing humanitarian assistance in areas of need. Project Hope is dedicated to providing lasting solutions to health problems around the world, as well as conducting humanitarian assistance programs in more than 35 countries with the goal of helping people help themselves. It plays a leadership role in forging alliances among those on the front lines of health research to address the world's latest health threats and seek new solutions. Its programs treat infectious diseases like HIV/AIDS in developing countries, educate parents, especially mothers, on how to prevent and treat diseases for their children and themselves, set up village health banks which give small loans to women to improve their health and that of their family, and train health professionals. This goal is of great importance because this training is what allows better health care to continue. Project Hope's motto is delivering health education, supplies, and volunteers where needed. Project Hope's history began in 1958 when Dr. William B. Walsh was the medical officer aboard a destroyer during World War II. While serving in the South Pacific, he saw extremely poor conditions, horrible illnesses, and death that could have been easily saved, or better yet, prevented, with simple medical knowledge and care. He, as a naval officer, had the idea of a floating hospital that would bring health education and better health care to poor communities all over the world. That year, Dr. Walsh persuaded Dwight D. Eisenhower to donate a decommissioned U.S. Navy wartime hospital ship, the USS Consolation. Over the next 2 years, it was turned into the first ever peacetime hospital ship and renamed the SS Hope. The iconic ship left for its first voyage on September 22nd. 1960, bound for Indonesia. It was stocked with donated supplies and staffed with volunteers and would complete a total of 11 voyages to Indonesia, Vietnam, Peru, Ecuador, Guinea, Nicaragua, Colombia, Sri Lanka, Tunisia, Jamaica, and Brazil. Before its retirement in 1974, doctors, nurses, and technical staff provided free medical care and training to the people they served. Training allowed improved health care to continue, and that is the method of the mission, teaching while healing. Afterwards, services became land-based, with its central headquarters being stationed in Millwood, Virginia. Besides self-transport, Project Hope has a partnership with the U.S. Navy called Pacific Partnership. Through this partnership, the Navy sends Project Hope's medical volunteers around the globe on yearly humanitarian missions, beginning with the aftermath of the 2004 Indian tsunami in 2006. The latest emergency mission was the 2013 Typhoon Haiyan disaster. For this mission, in addition to volunteers, the Navy and Project Hope shipped $1 million worth of medicines, medical supplies, and a 5-ton emergency aid package, including antibiotics, anti-inflammatories, generators, surgical masks, and gloves. This partnership is estimated to have served more than 250,000 people in 27 countries. Local healthcare training is the main focus of the project's mission. Dr. Walsh believed if volunteers gave people the proper healthcare education they needed, they could treat themselves. For example, in Central Europe, Project Hope's programs have over 3,500 healthcare workers who have been trained in the latest approaches in healthcare management, including disease prevention and treatment. Their work in Bosnia and Herzegovina began in 1992 after the Bosnian War, and since then, over 30 primary health clinics have been either rebuilt or established, and all medical staff receive 1 full year of training in family medicine that is recognized by the Ministries of Health. These clinics focus on primary care and healthcare management, care for special needs children, and HIV prevention. The global reach of Project Hope is worldwide and astounding. On the healing side of the mission, research is done into treatment of infectious disease, specifically HIV/AIDS, and tuberculosis. Hope has local programs that teach laboratory workers the latest technology so that innovations in prevention and treatment can be administered continuously at the community level. In Africa, TB is a major cause of disease and death, especially as opportunistically combined with HIV and AIDS. Project Hope has worked in countries there like Malawi to establish and support community efforts to implement a comprehensive TB control strategy, improve detection, decrease treatment failure rates, and decrease the overall TB burden. An amazing way they have done this is by using a fast diagnosis technology called GenExpert. It's an automated cartridge-based real-time molecular diagnostic test that can identify the Mycobacterium tuberculosis and resistance to rifampin simultaneously in about an hour and a half. Additionally, it doesn't require a high-level laboratory, so it's more accessible to the communities who need it. Even better, it's endorsed by the World Health Organization to be used in TB endemic countries, and they've declared it a major milestone in global TB diagnosis. As part of this 5-year program, supported by USAID, United States Agency for International Development, and begun in 2011, education and counseling were also offered regarding the disease processes, treatments, and outcomes of tuberculosis. Since the project's introduction, the TB treatment success rate rose from 60% to 86%. The same program was implemented in 4 countries in Central Europe, targeting at-risk populations. It is now being introduced in Central Asia. The foundation of Project Hope is women and children's health. It is for this healthcare and humanitarian reason that I would like to be a part of this organization. According to Project Hope's website, close to 10 million children under the age of 5 each year die from diseases worldwide, and in that same year, over 500,000 women die in childbirth. Most of these deaths are preventable. The project trains local healthcare workers in women's health needs like prenatal and infant care, child nutrition and immunization, and when to seek care at a local healthcare facility. As part of the Women's Health Program, Project Hope has created an empowering microcredit loan system called the Village Health Bank Program. It has invested over $40 million to help more than 24,000 women and their families in Honduras alone. The women can then achieve their dreams of starting businesses of their own, which allows them to afford proper medical care for themselves and their children. Project Hope's women's programs just like these are all over the world. They are in Nicaragua, Haiti, Indonesia, Guatemala, Malawi, Kyrgyzstan, Uzbekistan, and they have established baby-friendly hospitals in China, Poland, Iraq, and the Dominican Republic. Working with many cultures, helping the less fortunate, and especially empowering the women within those cultures are some of the reasons I love transcultural community health nursing. Working with Project Hope would be a dream job for a nurse anthropologist like me. I would have a unique opportunity to study, work with, and understand the women of a particular culture while I'm interacting with them doing nursing care. Here in the United States, we women are so free and have so many rights compared to women in certain other countries. It isn't until we begin studying them that we realize how limited our sisters' choices are when it comes to health care. It may be due to poverty or subjugation or both. If I ever get a chance to make a difference through Project Hope in a woman's life, I will.